Okay, just a quick overview. Um, in Nigeria, many individuals, especially within marginalized group, face a lot of exclusion, when it comes to quality healthcare. Persons with disabilities, people from low income families, and now people with mental health needs, face a lot of exclusion. And we're hoping that with the conversation that we would have today, we would come up with solutions that can lead to policy actions. I'm hoping that we can come up with something that if we left this place and we had 18 months to implement, there will be change. So we just don't want to talk for talking's sake. We want to address the key issues. So to start, I want to ask everyone the same question around what healthcare access means to you in your sector and what you consider the barriers to healthcare, especially for the groups that you work with. For Mr. Shegun, for example, in the mental health space, what when we say healthcare, and access, what does that really mean? And what are the barriers that you have noticed? I'll go and start with you, Mr. Shegun.
Okay, thank you very
You're
much,
welcome.
and good afternoon to everyone. I hope this has been an inspiring and engagement. Yeah, if you say healthcare access,
Yes.
I think is the one that recognizes diversity, that removes barrier, that adapt care to each individual need, and where people have access to a care support that respect dignity, that is fair, and that is also inclusive, and where people can have access to compassionate and competent mental health support. I think for in the mental health space, I think that's for just for a brief reason, that would be what I would call an inclusive healthcare access. When we want to talk about the
Yes.
barriers, I did mention that one of it is to remove barriers. And I think, like it's been said, and I think which are probably as a lot of the speakers have mentioned today, some of the major barriers are stigmatization, discrimination, cultural beliefs, lack of adequate workforce, lack of professionals that under in fact the professionals are even very, very, very minimal. They are low. And also facilities, lack of adequate facilities, and even facility not even having accessible infrastructure for people that are facing one kind of vulnerability or the other, or disability or the other. And also cost is a big one as well, because a lot of the health is not cheap. It's out of pocket. And also a lot of the health insurance do not even have coverage for people that are living with disability. And also even the public funding is a problem. And also, we have what we call, weak implementation of policies. A lot of the time in Nigeria, there are policies. It's just implementation. The leaders don't have the will to really implement this thing. They just have the document on the shelf or in the system. Weak implementation policy. And then, lastly, I would say socio-economic hardship, because things are really hard for people. And the marginalized people are even more affected. And I think let me probably just stop there. These are the few things that limitations, barrier that I think a lot of people are facing, much more the people living with disability.
So much. That's amazing. Miss Olubomi, can you help us with the same question? What healthcare access means to you and what the barriers are?
Thank you. Good afternoon, everyone. So I would say inclusive healthcare simply mean the access to, equitable health services and free of bias and free of discrimination and being able to have access and information that is required for you to be able to, you know, to understand that I am different. And can I also add that there is no such thing as normal, so it depends on your view and also your perception, and also which is shaped by your experiences. So that is what inclusive healthcare simply means. And can I just round up by saying that also the way we view things matter a lot, because if we extend grace to one another, we can actually be more tolerant and then be kind. You would not see anybody as a less of a person than you are. Thank you.
Thank you so much. Thank you so much.
All right. Yeah. Good afternoon, everyone. Okay, so with when you say inclusive healthcare for all, when you use all, it means no discrimination, no segregation for all, right? The healthcare has to give easy access, right? Number two, quality. Number three, affordability. If you read about charters on universal health coverage, right, that is what it says: health insurance for all. But what are the challenges we have in Nigeria here? I mean, the number one thing anybody will tell you is cost. Is healthcare cheap? No. What is even the government doing? So even the government that are supposed to promulgate policies that will even make this more affordable, they are not. The private man that goes to open a hospital wants to make profits, right? By the time he opens, okay, I'm trying not to call brands. By the time he opens one big hospital on Lekki, how many persons can even access those hospitals, right? So yes, so there's a universal coverage of for healthcare, and there's these barriers that we've all identified here. Thank you.
Thank you so much. I like that one thing that everyone does allude to is that affordability has to be addressed. And we see this play out not only in the health sector, even in housing. You know, when you talk about housing, they don't build the house, but when they build it, it's 25 million and it's supposed to be low cost housing. And you're like, for who? Who is going to afford that? So affordability is an issue. And I'm hoping that we will drive other conversations that will help us say, how do we move beyond that? Because it has come to stay. These are issues that cannot go away. So to Mr. Kingsley, my first question is really how can HMOs better serve low income communities and persons with disabilities? And how is IGEA working to improve access to affordable and quality care?
All right. So for HMOs, we all work on the principles of health insurance. And what is health insurance? Driving a pool. We gather this pool, we get money. So we say, okay, we have 100 persons here. Two persons go to the hospital. We use draw from this pool and give to these two persons, right? And when you even go abroad, health insurance is what they say everybody has to have, because if you want to even go to private hospitals, even in there, you can't even afford it. But by the time you have a working insurance system, I mean, in the UK you have the NHS. In Nigeria, we're supposed to have the National Health Insurance Authority. Well, we know how it is. Even the NHIL plans, how are they even working? So for us in Hygia, what we try to do is, I mean, no matter what it is, we try to make our plans very, very affordable, right? Just like you said, we have partners like Lafiami, right, to customize these plans. Say, okay, these partners even take these plans, even though we know we have highbrow clients, but the truth is, those ones, yes, they can afford, they can pay. But what about the people on the street? What about the market woman on the road? What about the vulcanizer? What about the woman that goes every day that cannot even afford these big hospitals? So for us, we try to do affordable plans, low plan, and still try to maintain that quality. So even while we're doing those low cost plans, quality has to be maintained. Quality has to be maintained. Thank you.
Thank you so much. Thank you so much. I was sitting with someone last week and she was saying to me how on one of our Lafiami plans and she just went to the hospital recently, did a lot of tests and scan and cervical. And this plan probably costs her. We have plans as low as 12,000 naira per annum. But this was maybe a 20,000 naira plan or something. But she did so much that she was like, I hope people are not going to tell me to pay out of pocket. But that's how much relief, you know, companies like IGEA are working, to make sure that that barrier is reduced. I'll move to um, Mrs. Olubumi. And my question is really around the barriers faced by persons with disabilities and the ones that are most easy to solve. We have digital, financial, attitudinal, barriers. Do you have any ideas as to how some of these barriers can be, solved, especially when it has to do with healthcare and access?
Thank you for that question. So, as I'm seated here, I'm speaking as a parent of a neurodiverse child or young adult, and I'm also speaking as a teacher, and I'm also speaking as an intervention specialist. So, look at me as three in one. So, one of the barriers which I feel as a parent is in healthcare, we do not have care plans for children or young adults who have neurodiverse conditions. For example, the ASD, that's autism, which is mostly known by people. We do not also have care plans that allow access to health for children or young adults who have dyslexia, dysgraphia, dyscalculia, ADHD, and all of this. So the barriers are a lot. If you walk into any general hospital, even if you walk into any private hospital, I can beat my chest to say that you would find just very few people, maybe just pediatricians, that know about neurodiversity. So if you do not know about you do not know neurodiversity, you do not have the required knowledge or information, how then do you know what to do? So if there is enlightenment and awareness and training for staff of HMOs, for staff of general hospitals, health staff and all of that, even PHC, the ones that are very close to the community people, that awareness and training would help everyone to know, to say that okay, we have people who fall under PWDs, that's persons with disabilities, but these are invisible disabilities. So that way, when information, they need information to know who to see, even though it's not medical, we can have, like a data that will help us to correct that, even if it's just an help desk for information to see that there are organizations or there are centers who provide these services. We can, create like a link and we bridge that gap. So it is important that they are trained, and then that removes the barrier. So the access to be able to not stigmatize, because there are something that even we have individuals, when parents go to hospitals, doctors are not even very patient to attend to someone who have sensory issues. Just like we are using headphones here to be able to, cut the barrier for the noise in other sessions, some people cannot even take that noise, and then so you find them trying to block their ears. The light that we are seated here and we are very comfortable, some people cannot sit down and be under that same light. I'm holding a gaze with you because I can do that, but there are people who cannot do that, and then they see it as I don't think I have time for this. So if we are able to correct all of that with training, it will help a whole lot of people to be able to understand that we have people who are not just there for medical, intervention, but other interventions. Thank you.
Thank you so much. Two things are standing out from what she's saying. She keeps talking about being compassionate, right? And then she's talking about training, because sometimes you can have a good product, a good service, a good policy, like Mr. Shegun said. But if people don't understand it or cannot use it, then it just does not work. It is not effective. So I'm going to Mr. Shegun, and the question is quite similar, but it's really about how we can integrate mental health into primary health care and health insurance. And I ask this because, unlike people with neurodivergent issues, mental health is not, on the face sometimes, but how can HMOs or even the government in terms of policy begin to include healthcare, mental health into primary healthcare, health insurance? How would this look like?
Okay, it's so it's so very disheartening. I came from a clinical background. I used to be a psychiatric, a mental health psychiatric in your city, Birmingham. Yeah, I trained in Birmingham and Coventry. So, and I remember we used to have there was one of the units I worked in Birmingham and Solihull Mental Health Foundation, this thing. And that unit, it was a psychiatric setting for people with deaf and dumb psychiatric unit. And because I did some work there, and I would imagine, and all the staff that, in fact, they offered me a deputy manager role in that place, but because I used just to cover shift there. But it's so amazing where they have a psychiatric system that they even have a unit for deaf and dumb people that are suffering, because their own dynamics is different, isn't it? Their complexity is different and their need is different. That's what I talked about adaptive healthcare system where it's inclusive and it take into cognizance each individual need. So what are some of the things that can happen? Is that one, I think the primary health system is probably what a lot of people who have access to. And let me also remind us in this room, majority of people living with disability, they live in a rural area. And the primary health care centers, they are their first call. So I would imagine that, or I will recommend that the staff, the nurses and the doctor, they can be trained in the common mental health issues where they can probably treat and manage them, except the matter escalates, it deteriorates. Secondly, they can help even embed counseling in the healthcare, in the primary healthcare system, where some people, they just need to be listened to, they just need to be heard, and when they train people in the primary health system, or where they even put some counselors there to attend to their basic need. And also, professionals, people need to be trained in mental health, in mental health issue. And because a lot of people need, because there's a lot of stigmatization and discrimination because of misconception. So there's a limited awareness about what mental health is and what mental health is not. And like we have in Africa, the first diagnosis when people see mental health, the first thing the most people think is that it's spiritual. So we need to really go beyond that so that we can, because these are what is causing these are what is causing stigmatization and discrimination. This misconception about what mental health is and what mental health is not. And people need to be trained, and also they need to have facility that is easily accessible. Facilities where a lot of, in fact, a lot of mental most of the mental health facilities in Nigeria, they don't even have, they don't even have ramp to access them. They don't even have wheelchair, wheelchair friendly spaces. They don't even have, they don't have elevators to even support people that suffer one disability or the other. So I think they need to make mental health facility even more accessible, because that's what we showed is inclusivity involved, in short.
Thank you so much, Mr. Shegun. He's raised very, very important, you know, points, especially when it comes to setting aside a unit and then people that are trained to actually, even if it's counseling, sometimes it starts with a conversation, and then even if there's no capacity somewhere, it can always be escalated. I'm sure there are certain things that you go to certain general hospitals in Nigeria for, and they're like, you know what, we're sending you to Bagada General Hospital. That's where the specialist is seated. So we can always start, and I'm sure we're going to get into the practical solutions. But as he was talking, that was a solution that I started to say, how can we even start somewhere? We may not start everywhere, but how can we start somewhere? Moving to Mr. Kingsley. And my second question, Mr. Shegun. My second question to Mr. Kingsley is really how HMOs can collaborate with health tech platforms, government, civil society, community based organizations to promote inclusive healthcare. So it's really more about collaboration. What would that look like?
Okay, so for technology, I would say for the HMOs. Okay, no, before I even go to this question, I think for us it's a learning process, right? It's a learning process. So just like the different specialties you mentioned, I mean, before everybody just want to go to the hospital, malaria, and we come out. People don't even know that there's something called psychiatrists, right? I mean, somebody is having one issues, everybody just say, "Oh, this is one thing." We just generalize and we use one word. But I think for us in the health industry, we're now trying to be innovative. We're now trying to adapt most of these newer innovations. So let me give an instance: telemedicine for tech, right? So you don't need to go to the hospital to see or to enter the vehicle, go and queue up. No, you can sit in the comfort of your house, speak to a doctor on the phone, right? Now, outside that, you can also do video calls as well via mobile app. That's what technology has come to play, right? So for us again, we have also done home deliveries. So these days, people don't even need to go to the hospital to pick up drugs. You do your telemedicine service, drugs can even be delivered to you at home. Even for our elderly people, right? You have now we're not being innovative, looking at plans that can say, okay, instead of this elderly man going to the hospital, why not even bring the doctor to the elderly man, right? They will not enlightenment. I mean, no matter what we say, if people are not even enlightened, right? Especially just like what you said, in a rural area, that's why we even have most of these people. Um, we can only do the much we can when it comes to primary health care, because at the moment it belongs to the government. But yes, the government also have their own part to play, right? And we, the private sector, we are everly there to help them do these sensitizations. Go to the community, do community health insurance. Yes, we'll do that. Even there's one way even high up on now. So what they are saying is, outside even providing this community health insurance, you come down, you do continuous sensitizations. So people should know that yes, there's something called health insurance. People should know that yes, this primary health center, they can come. People should know that when something is happening, or when someone has genotype issues, is not as we say, it's not a one J, is not yes, it's actually a health need. You actually come. So yes, we are very, very open to collaborate with governments. Government should also make policies. Just like the one of the panelists say here, there are so many policies. If you even take the NHI Act, right, there are so many policies. Go to different acts of the National Assembly. There are so many policies, but how many are we even implementing? How many are we even implementing? So we need to have all those sensitizations. Take healthcare sensitizations to the rural areas. They are the ones that need it very much. Thank you.
Thank you so much. Very fantastic point raised there. To Mrs. Olubumi, I want you to um, just follow up to the conversation Mr. Kingsley just had about at rural level. I feel like sometimes learning of neurodivergent issues very bougie. It seems like it happens to the rich. It's rich people's children that have ADHD, autism. But I know that in slum communities, maybe they've not named it or they don't even know what it is. Or just like Mr. Shego said, people are perceiving it as madness or, spiritual problems. What would that look like? Because it means like we have work to do at the grassroots level. How can we begin to move forward with this inclusion, but from the bottom in the sector that you work and with the category of people that you work with?
Thank you for that question. So I would in addition to what was said, I think we will still go back to, awareness and advocacy. Because if people are educated to know what neurodiversity is, and neurodiversity is not a disease. It is simply an umbrella term that is used to describe the natural brain variations. So, being different from you does not make me less of a person. So, if we are able to create awareness of what these things are and then be able to name them, it reduces stigma and then reduces discrimination, because with knowledge comes power. So, if we are able to train, let's say, teachers, because they are usually the ones, we have organizations that we work with at Dama Place that serve the underserved communities, so children who are out of school, and then and they are usually free tuition school. So we hold trainings for these teachers and also their caregivers, for them to be able to know how to spot children who have these conditions and see how they can also help. So with that tools, they are able to see how they manage them, and then they go on to see how they also learn, because we can all be in the same room and what I'm saying might be different from what another person is hearing. So if we are able to train the teachers and the people, the adults who work with the children, it helps us to actually reduce stigmatization. And also early intervention. Early intervention begins with information, because when you have knowledge, you know what you can do with it. And it is something that is intentional. So if I know about neurodiversity, it helps me to be able to say, oh, so this child or these children that have these conditions or these issues, oh, this is why they are struggling. So that way it helps me to be able to know what the next step to do, the next step to take, what actions or what organization can I actually reach to help them identify the specific disability that this child is having, and that way they tailor learning to that child's needs. So I'm speaking as an education person in this space now, so that's usually how it should go, and that's where we bridge the gap and then we move on from there. Thank you.
Thank you so much for sharing that insight. I know we're now racing, with time, and I just wanted to quickly ask Mr. Shego, and then we'll come to the last question. What low cost or community based mental health models are working effectively? From your experience,
Okay.
which of those models do you think are working that are easy?
Okay. Let me, one of our responsibility here is to correct some assumptions. So let me just briefly say something about, just like mental health, a lot of people feels most people that suffer mental health, there are people that most of these high-end people, the same thing happen to need neurodiversity issue. See, what happened is that the people that are rich, they have the resources to detect, to diagnose. So in a lot of the people that are living in rural areas, they are a lot of them live with undiagnosed, undetected, issues that people don't even know. But let me tell you, according to data, these things are higher in a low cost, rural area, low and medium and income environment. So those are the places where we have majority of these people. And there are statement I make, and this statement is that I say the primary problem is not the major problem. The major problem is usually managing the primary problem. So a lot of the time, why we're talking about this is management problem, because people have already been physically disabled, but the system or the way, the stigma or the way we are perceiving this thing is even making them more disabled. And that's why it's one of the things, because we don't want We don't want people, there's a proverb in Yoruba that say, deity, if you cannot help me, leave me the way you met me. So the system, how we are responding to this, the way we are saying it, is even making them more disabled. And it's really sad where people that are really physically disabled and they should now be made mentally disabled. And mental World Organization have shown that the biggest cause of disability is really mental health disability. Because if you have physical disability, your mental capacity you can still achieve a lot. It's just the system that is even making them more disabled. So what are some of the things that can low cost things that are working that can work? There's something we call task shifting or shift tasking, where, like I've mentioned, where the professionals, the practitioners they have in the system, in the primary healthcare, in the low cost hospitals, they can be trained in mental health, in understanding basic mental health issue, and giving them some basic training where they can take care of some basic issue under the supervision of a more professional person. One is that I will speak to the HMO as well. I know one particular HMO that sent client to our facility. I would encourage the HMO need to take up, making provision for people that suffer mental health issue, that they may need counselors, that they may need therapies, that they may need psychiatry, because I know most HMO in Nigeria do not have provision for psychiatric and mental health. I know because there's one HMO. In fact, we've been doing proposal to some HMO that they can, so that if that is covered through insurance, it will minimize the financial burden on the people that suffer mental health issues and I also have disability. And also, it can also be faith-based and NGO-led approach, where because a lot of the time these are the places people go first. So the NGOs, some NGOs are really doing well. They are doing well, but they can do more. The faith-based, the churches, the mosque, and whatever religion your affinity you have, they can start leading these things. And also, lastly, there's something we also call, peer support. People that have experienced, that have recovered, they can also offer support to the other people that are, like I said, in problem. People are in different degrees. Some, I would say, some are in nursery school of the problem, some are in secondary school, some even have PhD in that problem. So in whatever, you have people that can support you. And lastly, I think there should be what we call, a very strong mental health awareness. Because if we try to promote mental health, the awareness is there. This a lot of this misconception that is causing stigmatization and discrimination about people suffering with mental health issues that also have disability. Some of these things will be coped, and some of these things will be mitigated, and they can be minimized. I think with that few points.
Thank you so much. You've touched on many things, including some of our closing outcomes, because they are now telling us to wrap up. But I wanted us to put our final thoughts, but I want it to be something around, if we had funding for one pilot intervention right now, they've given us money to solve some of the pressing issues, what would that intervention be? Quickly, 1 minute each. Yes.
So for me, because as a mental health professional, the major thing I think is a mindset, psychoeducation, bringing awareness, opening people's eyes, bringing insight, illuminating people to be aware. Because everybody, even the people that are not doing well, it's as a result of not they don't have insight. So if they are insightful, if they are illuminated, because people only practice what they are convinced of.
Yes.
So if you try to convince them, persuade them, speak to their heart, possibly they will do better.
Thank you so much. Psychoeducation stands out there. Mrs. Olubumi. Yeah.
So for funding, and I would begin to say that awareness and training.
Training.
So awareness and training. When you are aware and you are trained to solve the problem with which you actually find yourself in that environment, then we move on from that same funding. We quickly go on screening. That's evaluation for young adults and then children that are in primary and secondary school. And we just do like a pilot project to see how. So when we are able to review what we've used that funding to do, we can now request for more and take it onto other schools, and then we just climb up the ladder from there. So if we do awareness and training, then we do screening to be able to identify children who need the support.
Absolutely. Thank you so much.
Okay, so for me, right, if I have the funds, I will underwrite more. The truth is, healthcare is expensive, but if you use insurance, it becomes cheaper. I mean, just like what you've said, in the past, HMOs don't do mental health anything, right? But for us, Hygia, for instance, I mean, we've added mental psychiatric benefits into our plans. In the past, HMOs don't do anything congenital, but now on our current plans, you have congenital, right? Congenital abnormalities we cover, of course, up to a certain extent, right? So if I have that fund, if I have funding, I will be able to underwrite more. And another thing that also stands out is the fact that we can customize. So I mean, if Lafiami comes and say, you know what, Hygia, give me a customized plan for so and so kind of people. Why not? If I have the funds to underwrite it, why not? Because at the end of the day, yes, the HMOs, even where we're trying to solve this need, there's also that business part of it. So if I have the funding, if I have that funding, I tell you, we the HMOs, Hygia HMO will underwrite more and add most of these things into the plan to make it affordable and accessible for everyone. Thank you.
Thank you so much. Just to wrap up, all of the thoughts, my panelists have talked about psychoeducation, training, awareness, screening and assessment. And I think that that's fantastic because you always start with knowing, what needs to be solved. And Mr. Kingsley has just talked about underwriting more plans because it's a business for the HMOs and the numbers must make sense. So thank you so much. We're going to take questions now. I think we'll be able to take maybe 3 or 4 questions. I have someone here. So let me take the questions first.
Hello, my name is Emeka Chuksunadi. I'm the founder of Swimming One Day, Sid Africa. And what we basically that in Nigeria, I am the only swim water sea therapist, and we have given over 600 scholarships to children living with disabilities so that their life is not going to be the same anymore, so that they could compete with their international counterparts from other parts of the world that are already getting so much more therapy. So when we talk about mental health, I'm so sad that I'm not here because swimming and water is the only thing that directly impacts their brains. And we have loads of video testimonies. And I'm begging, I've talked to the chairman and I've talked to everybody. I'm trying to get them to play a little video that we have made as an organization that is in collaboration with La Soda so that people could just have an idea of the miracle that water holds. The power in the water is so much that I don't understand that in Africa we're not tapping into it. I left my life in Europe and I moved here in 2022 and I started this. And I have to tell you, I started it with my money. I gave all these scholarships with my money. My family and friends are supporting, but the need is overwhelming. So when we talk about what water therapy can do, these are my people. If you look at Solomon, Solomon has an organization where we have a Deji. Deji cannot see. Deji cannot hear. Deji cannot speak. And Deji started a session with us. He also has a physical challenge. And Deji actually has depression and anxiety. And Deji also has suicidal tendencies and antisocial tendencies. And I have to tell you that if you see the progress Deji has had, in 7 days, Deji is now swimming in the deep end of the pool. And Deji, I don't think he's thinking of killing himself anytime soon. And this is the power of water. And when we talk in a forum like this in Nigeria without talking about water, it kind of saddens my heart. So I hope that we would be able to include this because it's so, so important to understand that lives could be changed. And if they would accept and we play that video, if not, you could all go to swimmingone.org and check this out because this is definitely going to change not just the lives of people living with disabilities, but every human being in Nigeria. Because while in Europe and America, swimming is an obligatory course. Here in Africa, what they do is that they say, oh, it's just swimming. It's not just swimming. It's not just water. It has a lot of power. So what we're doing is trying to make sure that people understand that it's a vital educational, health, and safety tool that belongs in all of our homes.
Thank you so
Thank you so
much.
much.
Well
It's
done. You're doing an
swimmingone.org.
amazing job. Thank you. Let's
Thank
put our hands together for him. Can we take the next question, please? Ma, please. Yeah.
Good afternoon, everyone. I want to appreciate the organizer of this program and the impactful personnel we have here. My name is Marvis Iso, founder Victoria Intellectual Disability Foundation. I want to appreciate Mr. Shegun. It's like you live in the slum too. I operate in the slum, Ijegun, within Ikotun Igondo LCDA. And you really captured everything. And as a mother, my daughter clocked 18th of November, and the journey started when she was 3. She was diagnosed to have autism spectrum disorders. As we speak, she's on wheelchair. Because we are talking about HMO, I want to say from experience that what our children need is therapies. The parents need counseling, the children need therapy. I started giving based on recommendation because my husband works in Lutz for 17 years because we want to curb hyperactivity along the line, seizure setting. Today, we are battling with pathological fracture. She's now on wheelchair. She can't walk, no talking. So while we are talking about enjoying medical intervention, let's please emphasize more on therapy. I advocate therapy. Once a child is given risperidone, go and write it down. That child in long distance time we start having seizures. And because you want to take care of seizures, so many other things we set in. They don't really need drugs. They need good food. Don't give food with preservative. No to Indomie, no to Semo, Amala and Eba. That God has given us without preservative will be a fantastic thing. Thank you very
Thank
much.
you so much and well done. I'll take the last question, please. Can you give him the mic?
Thank you. Thank you, everyone, for this wonderful session and panel. I would just like to quickly make some comments from the government perspective. Oh, sorry.
Oh, that's fine. If you want to sit, that's fine.
So I'd just like to make some comments from the government perspective because I see there's a lot of private interaction in the room, but the government has not been included. So that's the first flaw. A lot of times when we have these conversations, we have them outside circles, and then coming back after we've gone to the communities and seeing a lot of it, and then we now start looking for government. That government, why is government not governing? Who's sorry?
Yeah.
Hello. Okay, yeah, and all those other kind of situations that are supposed to happen. And so, to build an inclusive and a resilient system, like the panel topic is saying, we have to involve government in the conversations. You understand? You have to start it from the local level. So, and I always tell people there are 3 tiers of government. There's the local government, there's the state government, there's the federal government. So you need to narrow down what your scope is covering. The mental health panelist said, "Oh, the local communities and needs." So that's for the local government. And the Federal Ministry of Health recently said they released about 32 billion naira for all the primary health centers within the federation to be renovated. And I can assure you, I've been to a lot of primary health centers, and those renovations are actually going on as we speak. And that is an opportunity for you to interact with the government and make your case with the government. We are going ahead to do renovations. Now, you need to create desk spaces for counselors, you need to create desk spaces for therapists. As of when the money is now and when the plan is just about to be set into place and everything, you need to have that interaction with them. Then also, I also discussed that what the state is doing for the people with disabilities on the supply side. My colleague here, Mr. Kingsley, has spoken about what the demand side is. But let me tell you what's happening on the supply side. On the supply side, we've realized that disabilities are care that they are specialized forms of care. And like the demand side has already said, if you don't have the funds, you can't underwrite those plans.
Yeah.
And that's the beautiful thing about government. Though a lot of us in this room know that the Lagos State government this year dedicated about 3 billion naira for people that are vulnerable.
Mm,
And this is a pool of funds that can be tapped by both the private sector and the state government.
yeah.
We just want that partnership and collaboration. You walk up to us and say, "Oh, I have this segment of people that have been able to discover. How can we make their lives better?"
Yeah.
And like the woman right here rightly said, a lot of our HMO plans are catered for, let's say, curative and traditional medicine type of cures. Like, oh, do your football count, do your ECR, get these drugs and everything. Meanwhile, what these people need are therapies and the likes and everything, and not necessary. So, for the supply side too, we should start thinking about creating specialized centers for this set of people. We can come together and say, okay, I just from your yearly budget, drop 1%. I will drop like 15% from the government. So I create a specialized center that will cater to the supply side. So I'll have supply side centers in each and every local government that can make these interactions possible. Thank you. Those are my
Absolutely.
comments.
Thank you so much. Very important points raised, and collaboration is at the heart of it. One thing that we're promising to do from this session is to take some of the solutions that we've discussed, put it into a paper, and things that we can always use for advocacy purposes. So it's not just going to end here. Even though we don't have a government representative here, the conversations are not dying in this room. We will scale that. We can only take one more question. And now I'm not sure where to throw that question. Mr. Kingsley, do you want to help me? There are like five people raising their hands. I don't want to look that way. Who should I give the mic? I should give a female. Okay.
Okay, good afternoon, everyone. Thank you so much for this wonderful conversation. I work in a mental health setting, the child and adolescent mental health. So we have many professionals. We have the occupational therapist, speech therapist, physiotherapist, and the child psychiatrist, all in the same center. It's at Oshodi.
What's the name of the center? Because someone may be in this
Child and
room.
adolescent mental health center
Okay.
of the psychiatric hospital Oshodi. But the issue is we have many caseloads. Like so from the especially from the middle class and lower socioeconomic status. So parents come, they are coming in very much. So we have yes, we have Tuesdays and Thursdays are
Clinic days.
days. But the workload is so
It's enormous.
yes and the professionals are
Staffing.
few.
Yeah, it's always an imbalance there.
So I'm looking at maybe we can just collaborate with the HMOs because some parents have the HMOs, but they said so they usually ask if then their HMO can cover for therapy, and it doesn't cover for therapy in a private in a government setting.
Hmm.
So we are just looking if we can just create more awareness so that the parents can be informed.
Sorry, please, just so before you wrap, what does the cost of this look like? Do you know how much this comes to when someone needs this kind of intervention at your facility? So people pay out of pocket.
Yes,
Is
yes.
it government funded?
No, no, they pay. They
It's
pay.
out of pocket.
Yes,
So
they
what's
pay
that?
out of their pockets. So
Is it subsidized? What? Give me a range. What
okay,
does this
like
look like?
the
The cost.
therapy is 6,000 naira. For speech
That's,
therapy, speech is the most expensive. It covers just 6 sessions. But the
and how
physiotherapist
much
and
is the speech
occupational
therapy?
and for but 10,000 naira it covers for 6 sessions.
Wow.
You are some parents are
Cannot afford
actually
it, of course.
because their children are having like 4 different sessions of therapists, like the physiotherapist. That you know the therapists
At the
together
same time,
they have to get medications that are very
expensive.
expensive.
That's always
So
what
they can
happens.
also, but philanthropists come in and
Support
they
from time to
support
time.
once in a while, but still it's not enough.
It's an ongoing. We would keep.
And because of the fewer staffs,
Yeah.
the appointments list is always long. So you see parents coming just once in 2 months,
Hmm.
which the therapy won't
So that it
be
won't even be
that
effective.
effective. So and they cannot even afford private speech therapists because it's private speech therapist is
That's expensive.
really expensive.
Yeah.
So if some people that
So
are
these are
working in
things
the
we would also include, in our paper for the government, because these are things that only government funding can do, and maybe private sector support and collaboration. Let's take one more question. Okay.
Good
I didn't want
afternoon.
to give you because you're wearing ability.
Okay, good afternoon, everyone.
Good afternoon.
I'm Mr. I'm Mr. Michael by name. So a prolific and a professional American Nigerian sign language instructor. So I want to speak on the building inclusive and ask a question for my when we are saying that can you hear me?
Yes.
When we are saying that we are building the earth system for the inclusivity. But what about a situation whereby we have a deaf woman that was giving birth in a government maternity, and at the end of the day, they because of disability that the husband and wife are having as a deaf, do you believe that the doctor later sold the baby because um lack of interpreter in that health sector?
So
And I
injustice.
know that if there is sign language interpreter
Sorry.
so if there is sign language interpreter in that or something
Mm.
like
Mm.
so how's that the woman did a scan and in the scan where they did it not in that government hospital, it showed that there is baby inside that deaf woman. But at the end of the day, because I was in my church but I was not around, I traveled out of Lagos that time, but the deaf man was able to call the family but they were unable to show up because it was in the midnight and they do the cesarean section. So and that's how they just sell the baby. And they now wrote in the file that it has the woman has a fibroid, and it wasn't like that. So I want to like what this my brother said. He's talking about the government. Government has a very big role to play in this inclusivity. Though as a stakeholder as individual, we also have a big role. One of it is also to promote adequate sign language interpreters for the deaf people. For example, one of my friends from Ghana sent a video to me that a deaf person went to a health clinic,
Mm.
and the deaf was complaining like this, signing, using sign language. Is a congenital deaf person. The person cannot speak, and the doctor cannot understand. The doctor is just looking at this paper. What's this one saying? And the doctor just write anything any drug.
Oh my
But
God.
the deaf look at the doctor, gesture that this doctor
This no.
don't understand what I'm saying. And when he got the drug, the deaf was so scared to take the drug, which also result to
That's
anxiety. So,
crazy.
but if there is intervention of professional sign language interpreter in that sector, all these things will be eradicated. Thank you.
These are very important conversations because this is now not even an issue of an HMO plan or some. These are these are serious issues because this misdiagnosis, these further problems. You can't see someone that you cannot hear. You can't really see them effectively in terms of providing healthcare. But we'll take note of all of this. I want to take a question from this side. I understand that someone is asking, and I don't want to exclude them. Please let me take from this side.
Please,
Please.
I can't stand up, so I've been raising my hand.
Where?
Please.
Where?
Me.
Okay. If you can, please quickly.
Thank you very much. In support of what the young man just said, I think my name is Rabiat Rabiu, and I'm into the aspect and advocacy. So I think communication is very important because the health professionals need to be retrained. Aside from the training they has out of the secondary or out of their institution, they need to be retrained
Ongoing.
because there is a lot of things now going on.
Changing.
How are you going to a lot of people cannot go to the health sector because they've said it's going to take a long process. How are they going to communicate with me? How all this? And for the speaker on mental health, I have a neighbor who has been, let's say, locked up or tied for almost a month or more than because she's having a mental issue. And I think it's not even a thing. The family cannot avoid, um, cannot afford it because even to feed it is a whole lot. And this woman, I think to me, it happened when she gave birth to the last child, which I knew. And this woman is very hardworking and vibrant. But she has been locked up. Today, she might be stable today, and in the next few weeks, she'll be shouting, not sleeping at the whole lot. I plead if they can be helped. My community is a Keson community along Igondo. Please, this woman are really be tired up and there is no help. Sometimes they just give her sleeping medicine, and this is going to deal with a lot of things. And if you try to talk to them like LAT moju, it's actually need a intervention from outsider to please assist the woman. Thank you.
So that case sound like somebody suffering postnatal depression. So what I think, lawsuit, they have a center in lawsuit. So one of the things you can do is that person is a vulnerable person. You can get the social worker in Lagos State involved in that matter, and they will take it off from there. Just like Lagos State Minister of Welfare and Social Justice, whatever. They will, yes.
Yeah, you can always ask him again
Yes.
after this.
So lawsuit have facilities. They have facility for such presentation. But since because you felt that this is a vulnerable person, so the social worker in Lagos, the Minister of Welfare and Social Justice, they will come in. Yes, and they have them. They have them in the. I think there is a general hospital in Godo. They have social worker. They ask them. They will tell you what to do. Yes.
Okay, thank you so much. How can I take his question? Does he need an interpreter or he would ask directly?
Thank you so much. Good afternoon, everyone. Um, I want us to realize one thing about this problem we're discussing. The problem exists now, and now we are trying to find a solution to it. But what are we also doing to prevent this problem going into the future with us? For instance, I went to an hospital recently and I went alone. And the doctor looked at me and was asking me, am I sure I'm really blind? I told him, no, I'm not blind. I'm a deaf blind. He said, really? I said, yes. He said, how come I can blink? I just looked at him. I said, sorry, sir, am I talking to a medical doctor? He said, yes. And you're asking me how come I can blink? The level of ignorance is far higher than we
Yeah.
think. And so I come to the question, as we're trying to solve the problem today, what are we doing to prevent the problem going with us into the future?
Hmm.
That is something we need to think about. For instance, when we talk about inclusion, inclusion begins from planning to delivery. Every step of the way, you're supposed to think of inclusion.
Yeah.
And when you're talking of planning with health, it begins with what? All those medical doctors who are still in school.
Hmm.
Right from school, they should
The
be
training.
exposed to
Yeah.
disability awareness.
Yes.
Right
Absolutely.
from the university. For
Absolutely.
them to have that basic knowledge
Knowledge.
about
Yeah.
disability. So that when they finish, they start practicing, yes, they see a person with disability, they understand immediately.
Amazing.
That is one. Secondly, we need to encourage most of our patients with disabilities in our various clusters. In our organization, we did a research that was 2 years ago. And in that research, 70% of patients with disabilities said if they are not feeling fine, they would rather find other means to treat themselves than go to the hospital. Because of the attitude of the doctor, because of the high cost, because of the
Stigmatization.
way
Yes.
everywhere is not accessible and all that.
Yeah.
But now, keeping away from the problem does not help us to solve it.
Problem. Yeah.
We have to face that problem, face it the right way, and act for our right. But
Absolutely.
staying away from it will not help us to solve the issue. Those
Absolutely.
are the two issues that I like to.
Thank you so much. Those are very valid points raised. I like that he said that, even training for medical doctors, it's not when they graduate that we started. Yeah, it has to be embedded in their curriculum, from school. I'm going to take one last question, but I'm also hoping that Mr. Lekon and the entire Project Enable team are really, really taking note of the very salient points, because that's what Project Enable does, providing inclusion, even digital inclusion. These are valid points that must be raised. He said something that was important. It's not about the problem. What about the future? What are we doing to prevent the problem from happening? If not, we'll just keep coming year after year having this conversation and nothing really happening. Please let me take the last question. Him? Okay. Can you give us your question in 30? Can you no let him just go ahead. Go ahead with your own question in 30 seconds. Yes. Yeah, go ahead and speak.
So mine,
Oh,
mind
okay.
my communication. Well, I'm deaf,
Okay.
but I'll try my possible to speak as clearly as possible.
Okay.
All right. Firstly, all right. Firstly, I mean, all right. Firstly, right. Firstly, um, I want to point out some of the challenges I'm facing here. All right. This conference is very good. I'm happy that the stakeholders organized this. It's a welcome development. And I want them to be organizing this kind of conference from time to time, not only once in a year. All right. You see, for deaf people especially, let me start with them. This kind of conference, there should be a special amongst media projects or CV. Captions. where those deaf people that don't understand sign language
Yeah.
can just read from the blackboard. Because I am using an app, and at the same time, network issue.
Oh,
It's making it not flowing very well. You
okay.
understand? So I want them to take note of that. Then,
So you used an hearing aid for this.
yes,
Okay.
I'm hearing everything, but not
Okay.
all. Then at the same time, most of the speakers, they are speaking too fast.
Sorry about that.
They forget that there are deaf people here.
Oh.
You understand? So we want them to ensure that they make this place very comfortable for them. Not
Mm.
only this place, other conferences.
Okay.
Now I want to talk about the job market now.
Okay.
There-
The mic. Yeah. Give me that one.
So about 2 months ago, I went to a tech institute at Yaba to register for a digital marketing course. But to my utter surprise, they told me that they don't have special assistance for deaf people. I was stupefied. And I saw them that in developed nations, almost all the schools there, they have special attention for deaf people. Deaf people are also humans. They have the right to education. They have the right to go for healthcare. So therefore, they must provide all the enabling environment for them. They must provide all the necessary assistance for them to be able to read. They, go for education if they don't take education courses. How will they survive? How will they be useful to the society? So I took note of that, and I've been looking for the stakeholders in the disability industry sector to air my complaints to. But I'm happy that I'm here to do that. So now, in that kind of situation, I want the governments, especially the Senate, I want the senators to pass it into law that every institute, organization, supermarket, any business should be ready to assist deaf people.
Yeah.
If there are staff there who don't understand sign language interpretation, they should at least get a pen and paper and write for them. I mean, make them feel very special.
Very important.
Don't just discriminate them.
Yeah.
You understand?
Thank you so
Yes.
much. Thank
So
you
do
so
we have, lastly, do we have any minister of disability affairs in this country?
I'm not aware of that,
Okay.
except we elect that one
Okay.
today.
Please, I want the stakeholders to push it. There should be a special minister for disability
Project
affairs
Enable is
where they
hearing.
can take care of all the welfare, all the problems disability persons are facing in this country.
Yeah.
They should help them to solve all those problems. Thank you.
At Abuja. Thank you so much. The last question. Ewood. Oh, we can only take one more. I've been flagged many times.
Okay, hello everyone. My name is Ngozi Ike. So for the past 4 5 years, myself I've been trying to go to the hospital to meet the doctor to see him for that I have a health issue. And if I write to the doctor will be like, no, are you sure you have this health issue? Are you sure? I said, yes, I have this health issue. I need your help. It's for the 5 years now. I've been writing these things, we'll write and write. And the person will be like, no, that you don't have these issues. I will tell them to, okay, let me run test on this thing. Let me run tests and go for these things, but they will still not answer me. Then later I went to go to check, went for scan. It's in my stomach, and I checked. I had to go myself to go and do a scan on myself. I went to another hospital, another state entirely. You said, and they checked me there. They were like, "Yes, you have this issue in your health. You have this." But here in Lagos, when I went to the hospital, they don't want to believe. They said, "No, you're not sure of what you have." So I don't know why. I don't know. I don't know what's happening in our health system, in our health sector about with deaf persons. They don't always take our needs in prioritize. They always turn us down each time we go to complain to the hospital. And also, they don't believe deaf persons. That's just generally. They don't believe deaf persons. So, if we can advocate for us to be able to access medical health care easily, to make us be able to participate, as in to get our health, because most of us go to buy drugs because of this issue of accessibility. Thank you very much.
Thank you so much.
And to be honest, the biggest change always happens at the policy level. Like she was trying to interject and say that there's a national commission for persons with disabilities, right? But inclusion is a journey. Inclusion is a journey. we are not yet, we have just started to scratch the surface, right? And that is why conversations like this are important. Earlier in the year, we brought out the State of Disability Inclusion Report for 2024, which is to analyze where we are as a nation. And one of the key areas that is lacking in terms of inclusion is the health sector. And in that room that day, there were all the relevant ministries held in Abuja, the Ministry of Health, the Ministry of Information, and everyone are coming together. And of course, a report was shared with all of the relevant ministries. But we also understand that policy is both a governance issue and a political issue, right? And that is why the effort of the private sector sometimes is where we can go to have things happen, right? When you see organizations like ADI, Dama Place Learning, like IGEA, that are creating the services and not waiting for the government. What the government does is to enable people like them to be able to provide the service. And when they provide, when they are enabled, then organizations like them can then ensure that those services, of course, it has to be in partnership with the government, and that is why this conversation is important. But from all the services that they're providing, I know that ADI does for example, there's a counseling booth outside, where you can go there, see professional counselors, talk to them on certain issues, even if this is not the end of the conversation, but it can be a start to something, right? There is Lafiami here that is collecting all the big HMOs and helping you create it into smaller bits, right? From IGEA, and in such a way that it becomes accessible. But my answer at the end of the day, while we have raised all of this issue, we have to keep advocating, we have to keep speaking out, we have to keep showing up and demanding that things has to be done right. If we keep quiet, if we do not speak up, right? For example, this session is recorded. Apart from here, it's going to be on live, and when all of this is done, a report is also going to be generated from everything that has been said. The commissioner for youth is currently here, and one of the things he is going back, to his office with, is all the recommendations that we have all, spoken about here. So I think that while there's a lot to be done, it's important. I mean, it's a good thing that we're here. And then every one of us, your local government chairman, you know what they need to do. Now you know what is relevant, what is important. Now your local government chairman, the next time you see your governor, you now know the things to ask for, right? And I think that that is why this conversation is important. So I will give it back to Tosin.
So much. I mean, there's almost nothing more to say. A lot has been said, and it's progress from here. I feel like I don't know if and there are any thoughts. Do you have anything to add based on the reactions?
It's been a very engaging session, and sorry about that we were really fast. We didn't know that we were fast. Actually, I didn't know I was fast. Okay, so I think from what Mr. Owonikoko has said, we all have a part to play. We will not just stop at talking, because if we are just talking and we're not taking actionable steps, then we are not making any progress. So we would leave here with the thought that every one of us will continue to use our social media handles to to create the awareness and continue the advocacy, so that who needs to hear what has to, and then we take it up from there. Thank you very much.
Okay, so I think for me, right, it's been a mixed feeling for me here since, and personally, I think I would do more with CSR, right? So when we have partners come to say we want to customize this kind of plan, what jumps to your head first of all is business and MLR. What are they looking at? So how much are they paying? How much profit are we making? But I mean, from what I've seen here today, I think when I even have partners coming like this, I will be thinking more from the CSR approach to say, yes, this is what we're even doing to give back, not necessarily because we want to make profit. Yeah, thank you.
Okay, it's been a lot of learning experience for me, particularly the kind of job I do. I usually want to get experiential knowledge of the people going through them, and I like what this our gentleman said here. Actually, me as an individual, I prefer us preventing things from happening, promoting mental well-being, than doing intervention. The work I do, just like doctor, our major work is we are interventionists. But it's better we avoid the thing happening than we now intervene, because at the cost of at the point of intervention, pain has happened, losses has happened, and it's even more expensive. So with what he have said, I think one thing I would say is that, just like Olalekan just mentioned, see, people always act what they know. They practice their conviction. And I think it starts from conversation. People need to be more aware. There's a lot of awareness that has been brought to some of us here, particularly me, so that has inspired me. And it's going to change a lot of things, content, material, because we're going to integrate it into our content. So I think that's why I said, awareness is a big thing. Light is a big thing. Illumination is a big thing. Identification is a big thing. Recognizing, identifying what the issues are, what people are experiencing is a big thing, because it can influence it can influence us. It can help us to evolve, because things are really changing, things are evolving, and everybody need to act. And I think we will act from what we are convinced of. So I think it's been a very good learning experience, and it's quite very inspiring. Thank you, everyone.
You so much. It's been such a wonderful panel. Thank you for sitting through. Thank you for engaging. I want you to please leave this room and share some of your lessons, even on your social media platform, or even some of the things that you want to see changed. Let's use our platforms, because now it's your phone can reach Asia, just with a post. You can also drive this conversation. So whilst we challenge government, let's start to also create awareness and also be kinder to persons with disabilities and people suffering mental health issues, especially because sometimes it's not on the face. So let's be kind. And thank you so much.